And so let's talk about the study that you published. So derangement syndrome has been classified in a limited number of cases, right? It was like, I think it was 5 of 13, if I'm not wrong. So if it was not derangement, what would you recommend therapists to do?
Yeah, and that in some cases is the most important question to answer, because if you get the patient better, great. If you mismanage the other patients that are on the table, you're still potentially mismanaging half or more of them in some cases. Some of them are going to be appropriate for injections or back to consult with a podiatrist. That's probably what they wanted to do with the patient in the first place, is inject or a neurolysis or take the nerve out. I find a lot of these patients are sent over because they're particularly adverse to having some sort of advanced procedures done or invasive procedures. So, working with the podiatrist then at that point to say, like, look, if they don't do well in physical therapy, if they're not going to respond, to manual therapies or repeated movements, if they're not a derangement in that regard, or a peripheral nerve entrapment, then they will come back and maybe they'll get some better education to say, like, look, it's worthwhile getting that injection at this point. So that's one part of the population there. In the other part of the population, you're going to have patients with chronic pain or sensitization, allodynia, more or less. And whether or not you have an algometer or a dolorimeter on hand to be able to work through that education process and desensitization process to improve their tolerance. And then there's another population who may not necessarily fit into a clear category and doesn't necessarily respond to repeated movements in one way or another, and just may need more traditional interventions and stretching and mobilizations to the ankle joint to loosen things up and get them used to movement and activity and, alter their pain response. So, outside of the derangement and the other category, you've got that dysfunctional category, that peripheral nerve entrapment, that may also get a consult with the podiatrist while they're waiting for their symptoms to calm down, but may need repetitive stretching type activities to loosen adaptively shortened tissues. So.